What happens when crisis intervention gets confused with psychotherapy? Are these the same thing or are they different? That's what I'll talk about today. I'm Dr. Stephen Reidbord, a psychiatrist in San Francisco with a mostly psychotherapy practice. I conducted psychotherapy research early in my career, and for decades I've taught psychiatrists in training about psychotherapy. And this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Seeing a therapist, quote unquote, means different things to different people. Let me paint you two pictures, which, as I'll talk about later, are really the endpoints on a spectrum, a kind of continuum. First, some folks function pretty well in life. They're basically calm and happy. They have healthy, satisfying relationships. They're happy with their work or their school or raising their kids or whatever. But then something bad happens. They themselves or someone they love has a serious illness or has a damaging injury of some sort. A relationship that they really counted on and thought was reliable blows up in their face. They get laid off. I understand that's happening a lot right now with federal workers. Something rocks their world, something that's out of their ordinary experience, and they're not their usual self. The truth is, a friend I've known for decades had this happen recently. A close relative of hers had a sudden serious medical illness, and in worrying about the relative, she told me her thinking was scrambled, she couldn't sleep, she couldn't concentrate. She had a confusing mixture of feelings and fears. Basically, she's why I'm doing this video today. But anyway, that's one picture, the crisis. We're going to call that a crisis situation. The treatment approach for a crisis is called crisis intervention, and it can be delivered by a licensed therapist, although it doesn't have to be, and generally it's very short duration, sometimes one session or just a few at most. The goal is to return the person to their pre-crisis level of functioning as soon as possible. The intervention is usually very structured, often step by step, and focused on the particular issues or situation that is the crisis. The effort is to help stabilize the person's emotional state, to help them or encourage them to use the coping skills they already have, and sometimes to introduce new ones that are simple and easy to learn. Things like deep breathing exercises, guided imagery, and so forth. And finally, to offer emotional support and additional resources to use in the future if they're needed. Anyway, that's crisis and crisis intervention. And that's one picture. Hold that thought. In contrast, other people don't have any major life upheaval or trauma, just the small things that we all deal with day to day. But they've been depressed or anxious or both for months or years or maybe their whole life. They realize they have a pattern, a repeated pattern of unsuccessful relationships or unsuccessful work situations, even if they have had a series of relationships or a series of different jobs. These problems keep coming up. They may be drifting through life without direction or purpose, feel that they lack meaning in life. Or maybe they self-sabotage, they short-circuit their own happiness or success in life. Maybe they fundamentally don't like themselves. So this is a very different picture. It's not a crisis, it's a long-term problem or set of problems. And these things go by different names. Sometimes we call them personality issues, sometimes we call them repeated patterns, dysfunctional patterns. There's a technical term, recurrent maladaptive behavior patterns. Sometimes people call this getting in a rut, being able to get out, unable to get out of the rut. repeatedly having dysfunctional relationships, and sometimes we talk about inner conflicts where the person seems to be at war with themselves, getting in their own way. It's a kind of damned if you do, damned if you don't feeling. Now, these kinds of problems are the traditional focus of psychotherapy, a longer-term treatment focused in a more general way on overall mental health. In contrast to crisis intervention, psychotherapy is more comprehensive, addressing a wide range of issues and problems. As such, it can last months or sometimes years. These aren't simple, easily defined problems, after all. Sometimes we say that these problems took years to develop, and therefore it's not surprising it takes time to overcome them. In its traditional psychoanalytic or psychodynamic form, the kind I practice, psychotherapy is relatively unstructured. It's certainly not step by step. The therapist acts as a facilitator for self-discovery, in addition to offering support and encouraging the client or patient to use the coping skills they already have, and sometimes to introduce some simple new ones. For example, to recommend journaling or relaxation exercises. A lot of the focus of traditional psychotherapy is discovery of new ways of coping that arise organically in the therapy itself, not by suggesting tips, tools, and strategies. And in traditional psychotherapy, the therapeutic relationship is very central, actually considered one of the most central parts of the healing that occurs in psychotherapy. So when you think of seeing a therapist, quote unquote, it helps to think about whether you're really seeking someone to help with a crisis, to do crisis intervention, a relatively concrete short-term intervention for a specific problem that's facing you despite a life that otherwise is pretty good, or whether you're seeking psychotherapy for ongoing, chronic, long-lasting problems that have troubled you for a long time, but maybe something has finally gotten you to the point of seeking professional help. Now, at the beginning, I said that these were extremes on a continuum. What did I mean by that? Well, for one thing, people, even with these long-standing problems, often finally come to see a therapist because of one particular thing that happens. A person might realize that their relationships have been rocky for years, but they thought they finally found that one special person, and this would be an exception, and they'd be live happily ever after. But this one blows up too, and they finally have to recognize that it's part of a pattern. They can't deny it to themselves anymore, and that finally gets them to see a therapist. So even traditional psychotherapy does deal with life crises and immediate stresses, but it puts them in the larger context of the person's whole life. It doesn't limit itself to the one thing that brought the person in. Another way that crisis intervention and psychotherapy falls on a continuum is that a lot of what's called therapy these days is in between by design. Getting tips, tools, and strategies is a part of a lot of psychotherapy nowadays, but really it's like halfway to crisis intervention. It can't address the roots of long-term baked-in problems. And in this video right here, I talk about how tips, tools, and strategies, it's kind of a myth to think that that's the primary thing that psychotherapy is. Likewise, crisis intervention often includes advice about how to deal with or what to do with the crisis situation, especially if it's still happening. But psychotherapy is not about advice, something I talk about here. So maybe it's the result of kind of a common feeling nowadays that every stress is quote-unquote trauma. Talk about that here. Or that a brand name therapy that's custom made for a particular problem is somehow superior to a psychotherapy that looks deeply at the whole person. But these are myths, mistakes, in my opinion. My advice is if you generally function well, but you're dealing with a specific crisis situation right now, get crisis intervention. Save yourself the time and money. You don't need psychotherapy. But if your problems are ill-defined, wide-ranging in your life, of long severity, it's better to seek psychotherapy that really aims to get at the roots of these problems and doesn't waste your time with superficial interventions that are really best suited for crises. Let me know your thoughts about crisis intervention and psychotherapy. Please put those comments below. I read every single one of them. Let me know if you agree or disagree. By the way, if you ask me a thoughtful question, I'll give you a thoughtful answer, sometimes pretty lengthy, and I've done that before, and I promise I'll keep doing it. Please like this video, but only if you really like it. Please subscribe if you have not already. And if you have a few more minutes, why don't you check out this video, which is also about psychotherapy and psychologically informed psychiatry. I'll see you next week.